Welcome to ITV Gold, Dr. Priti Jain. Thank you so much for being with us here.
Thank you, Aditi. Thank you for giving me an opportunity to be on IGTV.
Of course, just having you here on the show, Dr. Jain, I kind of want to look at the numbers that we have coming in today in terms of COVID-19 cases in the United States. We're looking at 1.5 million cases today, and we're also looking at more than 90,000 deaths just in this country. When we're looking at these kind of numbers, this is a question I've been asking my doctors, how should we process this? But my question to you also is, in terms of processing, how should we sort of understand what these numbers truly mean right now when we're saying that the curve is bending down?
Aditi, that's a very good question. I think it's a question that generally everybody faces when they're given data like that. So before I even start, I think any data that we interpret right now should be taken with a pinch of salt. And I'll explain in a few minutes why it should be taken with a pinch of salt. So one of the terms that I'm going to talk about is called the CFR, or the case fatality rate. That rate is actually the number of deaths per 100 people. And we know that in COVID-19, the number of deaths or the case fatalities or the CFR, as we have extrapolated from countries such as South Korea and China, is anywhere between 0.9 to 2.5, which means that for every 100 people infected with COVID-19, 0.9 to 2.5 people are going to die. So that I find a more accurate data to look at. So based on that number, if we've had 90,000 deaths in the United States, we should be seeing anywhere between 3 to 5 million cases. But in reality, we've only seen a positive number of 1.5 million. To me, all that means is that we have not tested enough people. So if we were to test more people, I'm sure that number would be much higher. A more accurate metric to go by is the number of deaths, because I think that at the end of it, that reflects what it reflects. And I think based on the number of deaths, if we take that data out, then we should be seeing a lot more cases of COVID-19, which we are not, or which we don't see because we have not tested enough. So I think the bigger number that you're talking about, which is 1.5 million, is ideally it should be anywhere between 3 to 5 million. If we had tested enough people, we would have found that.
Dr. Jain, you just reflected on the curve as well. They're saying it's bending. My question to you is it truly bending? And if so, is there a decrease in the number of deaths? Because as you just said, the number of deaths is a more important number to go by.
So yes, again, a very good question. So the curve is definitely flattening for the number of hospitalizations, which I think is a much better metric than actually the number of people being tested, because the number of people being tested, the top of that number is limited by the number of tests that we do, but the number of hospitalizations, again, are what they are, and that number is definitely flattening. So I think that's a very encouraging sign that the number of hospitalizations from COVID-19 is flattening. And again, between mid-February to mid-March, we had a huge exponential rise in the number of cases, but that number also seems to have flattened more, I think, because of lack of testing or lack of enough testing. I shouldn't say lack of testing, but lack of enough testing.
Right. You just mentioned testing, doctors. Let's just discuss it. There's so many questions in the market about A, rapid testing, and then B, antibodies testing. What could you tell us in terms of both kinds of testing, and how many tests do we have to do per day to truly figure out how many COVID cases there are that are positive, and also how to tackle the situation?
So let me first touch upon the testing a little bit. So there are two types of testing. Grossly, there's antigen testing and antibody testing. And antigen is the piece of the virus that we test for. When somebody tests antigen positive, it means they have the disease for the most part. And antibodies are the second test, which is the antibody test. The antibody test, antibodies are little proteins, or almost like if you were to think of little missiles that your body makes to fight an infection. So all antibodies in our body mean is that that it means is that it's a sign of a prior infection. So there's antigen testing, which is done through the nasal swab, where we take a piece of the nasal secretions and we process that. If that tests positive, then that means you have the disease. If you test antibody positive, there are two types of antibodies, IgM and IgG. for sake of simplicity, I'm only going to talk about IgG, which a positive IgG antibody means that you've had the infection in the past. That's all it means. At this point, we don't know whether this antibody is going to give you enough immunity towards another coronavirus infection, how long the immunity is going to last. We don't know any of that.
Do you think people that are testing positive for these antibodies, are they now allowed to go outside? Could they mingle with their family members? Could they see, their grandchildren? What do you have to say about that?
So I think there's a lot to be determined about antibodies at this point. I think it's a great thing that somebody has antibodies, but like I mentioned earlier, having antibodies doesn't mean that you're immune to another infection, or we just don't know. We don't know whether it's going to give you immunity towards another infection. Maybe it's going to give you immunity towards one strain and not towards the other strain. So there's a lot to be determined in terms of antibodies and what kind of protection they're giving you. So my current recommendation to anybody would be, even if you're antibody positive, be a little patient, still carry on the social distancing, the masks, the hand hygiene, all of that stuff. Try and keep yourself isolated. All the stuff that you've been doing so far shouldn't really change because now you're antibody positive.
Could you give us some latest insight into the virus itself? And my question to you following up to that would be, is there a concern for a reoccurrence of this virus right now with the way the country is reopening, with the way we're seeing the economy reopen as well? What do you think is going to be the implication on the health crisis system here?
So I definitely think that there's a very good chance that we're going to see a resurgence of this illness, as well as an increase in the number of cases as we prepare to open up the country. So reopening or lifting the lockdown is a very fine balance between having our economy run and keeping people safe. And it's a decision that the government makes. I think nowhere in our history has there been a greater time to kind of display more personal responsibility as of now, which means that even if something reopens, or even if the entire country reopens, the virus is still there. The virus hasn't gone anywhere. And I don't want people to start thinking, oh, because the government said that we can now go out and go about our normal business, that the virus has disappeared. It hasn't. The virus is still there. All it means is that we still need to practice the same measures that we were practicing now, which is social distancing, hand hygiene, masks. And there's a good chance that once again, if the number of cases rise exponentially, there's a good chance that we may have to go into lockdown again. So we just have to be prepared for that.
What are the requirements from a medical point of view to reopen the nation?
So honestly, there are no requirements from medical. I mean, there is obviously a lot of stuff going on from the medical point of view, but strictly from a medical point of view, there aren't. I think the whole thing about the curve more than the more than the reopening was the fact that we did not want to overwhelm our medical systems, which is why sooner or later, everybody is possibly going to get infected. But instead of the curve going up exponentially, we wanted the curve to flatten out. So if this was the hospital capacity, we wanted the flattening to remain below the hospital capacity so that the hospitals could take care of the patients. So what happened was, initially it was like this. So we exceeded our hospital capacity. And that's why, so many people, unfortunately, could not receive the care that they needed because our hospitals were overwhelmed. So I think from a medical standpoint, that is the only concern, that at no point should we overwhelm our medical system.
And what are the current conditions of, healthcare facilities, clinics, and hospitals right now, according to you, in terms of the PPE supply, in terms of the things that are needed in there? Are there enough right now? Are all of the medical units ready for perhaps a resurge if it happens?
So I think initially all of us struggled a lot to find, even vendors that had certified PPE. So I'll tell you, in our offices, all we use is PPE that has been certified, that is certified to be used by medical personnel. I think there have been a lot of fakes in the market, and we've been vetting those out very, strictly. I think at this point, as a practice, we do have enough PPE. Are we preparing for another pandemic in the future? Absolutely. I don't think any medical practice or any hospital is going to be caught again in the future with their guards down, because I think we've realized after this that we definitely need a good stock of the PPE. I think most people, if you have really medical grade PPE, should consider donating it to medical practices and hospitals near their house. And definitely people should try not to hoard any N95 masks or, any isolation gowns that could actually help save healthcare professionals.
What is your location's greatest need right now then?
So I think the greatest need for our locations is, I think, absolutely for people to feel comfortable coming or seeking healthcare, because I think we have definitely seen cases. The number of people that died at home actually over this crisis almost tripled or quadrupled, and some of it was because of the COVID-19 infection, but I think some of it was also because people were choosing to delay seeking healthcare. And I think our greatest need is to serve our community, keep our communities healthy, and I think just going off of that need is for people to feel safe going into medical offices, going into medical facilities, and also realizing that televisits are an option. If they have any concerns, to make a televisit appointment earlier on in their illness so that they can be guided by a medical professional about what the next course to follow would be.
Dr. Jain, if I was to ask you how COVID-19 has impacted critical care and the everyday businesses of, a doctor such as yourself, what would you say? And, how massive has this impact been on you specifically?
So, Aditi, if I can say this, I don't think life is ever going to be the same again for any medical practice, for any individual that has gone through this crisis. So, I don't think doctors are any more exempt than the other public, but I think it has really taken, it has, it, everything has a silver lining, right? So, it has really helped make our infection control practices better and more strict. And I think it has really opened our eyes to really, making sure what protects our people, what protects our patients. And I think just realizing, how much mental health is important at this time, realizing how, how people can really adapt to a new lifestyle, just like we have, as medical practices, we haven't closed a single day. We've remained open through the entire crisis to be able to take care of our patients and our communities. And I think it has really helped us kind of dig deeper, find ourselves. And it has really, even for my team has been amazing during this entire crisis. And just having all of them, come to work every day, excited to help other people. And I think that's a big thing. And for a healthcare practice or a healthcare worker to realize why they're doing this is really what we have learned from this crisis. And of course, all the other things that come with it, how are we keeping our practices safe, how are we guarding our people, what are we going to do to keep our patients safe, what are we going to do to keep our staff safe. So a lot of little questions have come up, but I think we've all learned a lot from this crisis.
What are some of your, ongoing concerns right now, especially for the next couple of weeks, while we are looking at even places like New York City, look at reopening as an option? What are you concerned about?
What I'm mostly concerned about is, like I mentioned earlier, I don't want people to think that with the reopening that the virus has gone. The virus hasn't gone anywhere. The virus is still here. So everything that you guys are doing up until now, which is social distancing, hand hygiene, wearing your mask when you're out in public, remains the same. And it's really, really important. And I beg everybody to make sure that they continue the same preventive measures that they've been continuing up until now, because definitely there is going to be an increase in the number of cases once we reopen.
Your comments on at high risk patients, a lot of South Asians have chronic illnesses, they have diabetes, cholesterol issues, heart diseases. What's some advice to them? And, when we're looking at, again, this whole reopening situation, do these people have to be particularly very careful about their health?
Absolutely, 100%. So what we have found, just looking at the early data that we've gotten, and I think North Shore published a study with about 3,000 patients, I think being overweight, being diabetic, having high blood pressure, and having underlying lung diseases were probably the biggest risk factors for having a more serious version of the disease. All of us could get the disease, but people with these diseases could actually get sicker than most of us would get. So my only advice to these patients would be absolutely to make sure that they stay up to date with their medications, make sure that their doctor gives them a 6 months refill on all their medications, and above all, to stay isolated. Their family members need to exhibit a lot of responsibility. If their family members are out and about and working, making sure when they come back into the house to take a shower, to change all their clothes, to really wear PPE while they're out and about, and then when they come back inside the house, to, really decontaminate themselves so that they don't transmit anything to their more vulnerable family members.
Dr. Jain, if I was to ask you how, the viewers that are watching you right now could perhaps work on building their immunity, their nutrition, to just be, healthier and better during this crisis, what would you suggest to them?
So I think there's definitely, when I look at wellness in the physical sense, in the emotional sense, and in the spiritual sense, right?
Right.
So in terms of physical wellness, I think definitely there's never been a better time to exercise, to, get on that treadmill, get on that bike, go for a nice walk. The weather is really warming up nice, so go for a nice walk, a brisk walk. So exercise definitely. In terms of physical, again, making sure that you get your supplements, vitamin C, vitamin D. There has been more data recently about high levels of vitamin D and how that builds up your immunity. So definitely taking anywhere between 1,000 to 5,000 units of vitamin D on a daily basis, I think is really important. Vitamin C, zinc, all of those are really important things to do. Spiritually, believe or have faith in a greater being, greater than yourself. It doesn't need to be God, but whoever that greater being is, have faith, have belief, have hope. And then on an emotional level or even on a mental level, think about meditation, think about building serious relationships, connect with your loved ones, connect with them over the phone, connect with them over Zoom. Just building those relationships actually builds your immunity better. And then definitely the last but not the least is sleep. Make sure you get enough sleep. 7 to 8 hours of sleep is really optimum, just so that your immunity remains at its best.
Dr. Jain, if I was to ask you about your personal experience and what has it taught you, what would you say? But also, how has this made you, in terms of a medical professional who's serving the community right now? How have you looked at this entire situation while you're on the front line?
So I think one of the things that I've realized during this is how little everything matters in life, right? Like we have no control over anything. I think all we can control is our reaction to something. But other than that, we cannot control anything. This virus had to happen, it happened, right? So I think, first of all, it has shown me that as humans, we have very little control over our surroundings or what we can do. All we can control is our reaction. That's number one. Number two, I think what it has really shown me is, just even getting up in the morning, the chance to help other people, the chance to keep our communities healthy, the chance to keep families safe is really what has gotten me and most of my team up early in the morning, excited to work another day, to, take care of people for another day. And I think what a lot of us have learned through this is really where that service, that we are so blessed to be able to help others, that we have that sense of service that we want to share with others. And I think that is probably what it has taught me at a very personal level.
Dr. Jain, it's been great having you here on ITV Gold. I just have two, questions left here for you. I'd like for you to give a message out to our audience, perhaps some tips and measures, even more that they can practice, during this time period. But also, if you could give a message out to your fellow medical professionals, I think that would be great too.
So I think to my fellow medical professionals, I'm going to take that first. A big, big, big gratitude for their selfless, just amazing service that they have provided to people. It's literally like going to war every day, sometimes without enough weapons, but they have done it day in and day out, taken care of people. And really at this point, I just don't have anything more to say about fellow healthcare workers, nurses, respiratory therapists, doctors, medical assistants, front desk people, all these people that have really not even given a second thought to their own health, to their own, survival, have actually gone out and helped all these people so selflessly. So for that, a big, big, big thank you from the bottom of my heart. And I think to our audience, all I want to say is this too shall pass. It'll pass. We'll all be fine. And again, make sure that at a personal level, you do what is right. You do what being responsible means, which is wear a mask when you're out, social distancing, washing your hands, and meditate, sleep well, eat healthy, take your medicines, do whatever you need to stay healthy, and be kind to others, because there's no other time that they've needed this more.